Hey everybody, in honor of Disability Pride Month, I'm going to talk about my newest diagnosis, which is Marfans Syndrome. I thought it was EDS, Ehlers-Danlos, for 30 years of my life until I got my diagnosis last summer. So I got this paperwork, so I'm going to read the research I found. Marfans syndrome is a genetic disorder that changes the proteins that help make up healthy connective tissue. This leads to problems with development of connective tissue, which supports bones, muscles, organs, and tissues in the body. Mutations or changes to a specific gene causes Marfans syndrome, and most people inherit the disorder from their parents. Now, we haven't done the genetic testing, so I don't know if mine is from my parents or a mutation. Symptoms of Marfans syndrome can be mild to severe and vary because the condition can affect different areas of the body, including skeletal, which includes bones and connective tissue such as ligaments, tendons, and cartilage, which means I can break or dislocate things very easily. Eyes, as you can see, I wear glasses. I have what's called myopia, I don't remember how you pronounce it, but each year I go get my eyes checked and they get worse and worse. I also have astigmatism in this eye, I think. Last they checked anyway. And I'm very nearsighted. Heart and blood vessels, including veins, arteries, and valves inside the heart. Especially the aortic valve. They have to check my aorta constantly. I have a cardiologist on retainer. Skin, as you can see, my skin is very thin, very elastic. As you can see, my joints are junk. Lungs, which means I can't breathe very well, fight sinuses a lot. Stuff like that. Anyway, I'm running out of time, so I will continue this in a part 2. If you're still interested, check it out. And we're back to do more info about Marfans syndrome in honor of Disability Pride Month. Woohoo! Okay, so I stopped with what it affects. Treatment for Marfans syndrome varies depending on the area of the body affected and may include medication, other treatments, or surgery to manage the condition and its complications. Research and advances in treatments and surgeries allow people with Marfans syndrome to live long, productive lives. What happens in Marfans syndrome? Everyone has a fibrillin 1 protein, which makes elastic fibers and connective tissue. Fibrillin 1 also affects another protein in your body, transforming growth factor beta, TGF-beta, which helps control how the body grows and develops. People with Marfans syndrome inherit a gene mutation that changes how the body uses the fibrillin 1, leading to excess growth factors, which causes tissue and blood vessels, the heart, ligaments, tendons, and cartilage to stretch more, making them very weak. Overgrowth of bones, making them longer than usual. As you can tell, I have long fingers, my toes are very long, and when I stand up, back up. Okay, my torso isn't very big, but I'm all legs. So, people say I don't have all the characteristics of Marfans syndrome, but I did the blood work. They say I have Marfans. I trust the doctors. Anyway. Who gets Marfans syndrome? Men, women, and children can all have Marfans syndrome. It is found in people of all races and ethnic backgrounds. So it's not just white people. It can affect anybody. That's why the disability community should not have what's called oppression wars. We're all oppressed I mean, yeah, there's ableism, there's racism, and yes, different races also have to deal with racism in addition to disability discrimination. But we shouldn't hold our races against each other. We are all in the disability community. We should all practice love and unity to fight ableism. Anyway, there'll be a part 3. Peace out. Hey everybody, we're back again for another Marfans. I don't know. Trying to do something cool and anyway. Sorry, I'm kinda because of pain medicine. Anyway, we stopped off right before I got to symptoms of Marfans Syndrome. Alright, the symptoms of Marfans Syndrome vary from person to person because of connective tissue is found throughout the body. Some people have mild or just a few symptoms, while others can have more serious problems. Symptoms may include abdominal pain. Check, because I have a bad stomach. Arms, legs, fingers, and toes that are much longer in relation to the rest of the body. Check. Chest that caves in and out. Well, you really can't see it because I'm not going to take my shirt off. But you see how my stomach is right here, but my chest sticks out, even though I have hardly any breasts. My chest caves out. If y'all want, I can do a picture with a hospital gown so y'all can see better. Curvature of the spine, scoliosis, check. Flat feet, check. Headaches, ding ding ding, constantly. Heartbeat that feels like it's skipping a beat, fluttering, or beating too hard or too fast. Check. Even though I do the pulse ox, and it says my heart rate is regular. Highly arched mouth that can lead to crowding of teeth. Yes, as you can see, I had that. I had a high palate. I had braces to fix that. I had 2 teeth, I think, removed for that. I don't remember how many teeth I got pulled. All I remember is I got $20 and got to miss school. Yeah. Loose joints. Check. Lower back pain and numbness in legs. Check. Shortness of breath due to changes in lungs and heart. Check. Stretch marks on the skin. I'm not showing y'all my skin, but check. Let's see. Vision changes such as blurry vision and extreme nearsightedness. Check. I got all the symptoms. Lucky me. Woo! There's some more, but I gotta stop because I'm running out of time. So, symptoms will continue in a part 2. And we're back. We only did halfway through the symptoms of Marfans. Alright, because Marfans syndrome affects different areas of the body, other problems and complications can develop, including aneurysm of the aorta, which is why I have a cardiologist on retainer and see them once a year. The aneurysm of the aorta happens when the wall of the aorta weakens and bulges. It is a life-threatening emergency if the wall of the aorta ruptures. So, yeah, that's something I gotta watch out for. Cataracts, yes. Every time I go to the eye doctor and they tell me it gets worse each year. I don't remember what my last vision test said, but they said if it gets much, much worse, like 3 or 4 more, I don't know how to describe it. They said I will have to have LASIK to keep from getting cataracts. Which cataracts are cloudy areas in the lens of the eyes. Dural ectasia, which happens when the tissue that wraps around and protects the spinal cord and the brain stretches and weakens. Let's hope that never happens. Ectopia lentis, which happens when the lens of the eye shifts, leading to changes in vision. I may have that. I don't know. Glaucoma, a group of eye diseases that can cause vision loss and blindness by damaging a nerve in the back of your eye. I don't have that yet. Heart valve leaking. I do have a small leak in my aorta, by the way, which happens when one of the valves inside of the heart is not working properly. If the leak is significant, it can make your heart work harder and affect its ability to pump blood, which it's a minor leak, so they're not concerned. They're just watching it. Jeez Louise, they still got more? Jeez. Hernia in the abdomen, which happens when the tissue pushes through the weakened wall of the abdomen. I don't think I have a hernia yet. Anyway, I don't know how to pronounce this one. Pneumothorax, which happens when a section of the lung collapses because of the alveoli. Tiny air sacs in the lungs burst. Don't have that yet, thankfully. And we still have 3 more left to go, and I will continue in the next part. Peace out. And we're back again for more Marfans info. And we have 3 symptoms left to cover. Okay. Retinal detachment, which is where the retina in the eye is pulled away from its normal position at the back of the eye. I don't have that yet, but they said I gotta watch for it. Sleep apnea. Check. Or I have symptoms of it. The doctors say it's not technically sleep apnea. They say it's because my lungs were so crushed by my spine of my scoliosis that they had to adjust the way they worked. So, anyway, sleep apnea is the upper airway becomes blocked during sleep, leading to breathing that starts or stops. Which, I didn't get diagnosed till I was 21 for sleep apnea after my back surgery. I went 21 years, probably not breathing in my sleep, which would explain why I woke up with headaches every morning. Anyway, weakened or stretched aorta, which I think I have that. They watching my aorta very, very thoroughly. Weakened or stretched aorta, which is the large artery that carries the blood from the heart to the rest of the body. Damage to the aorta increases the risk for serious heart problems, even sudden death. Okay, yeah, that's not scary at all. Hence the sarcasm. Okay, now we're covering causes of Marfan syndrome, which is a mutation or change in the fibrillin 1 gene. People with Marfan syndrome inherit one normal copy of the FBN1 gene and one abnormal copy of the FBN1 from their parents. The abnormal copy of the gene is stronger or dominant over the normal copy and causes the Marfan syndrome. This is dominant mode of inheritance. A person with a dominant mutation has a 50% chance, 1 in 2, of passing on this disorder to his or her children. Yeah, so if I'd ever have children, they have a 50% or greater chance of getting my disability. Yay! Yeah, I think I'm not having children. Not biologically, anyway. Even though I do want to be a mom. I'll adopt or foster. Some children are born with this syndrome even though there is no family history of this disorder. Let me repeat that. Some children are born without there being family history of Marfan syndrome. And it's a new mutation. They don't know what I am. I'm a medical puzzle. Woo! I hate puzzles. Alright, now we are going to discuss diagnosis of Marfan syndrome. No single test can diagnose Marfan syndrome. Instead, to diagnose this disorder, your doctor may ask about your family and medical history, specifically about any family members with a disorder or who had early unexplained heart-related death. Perform a physical examination, which can include measuring how long your arms and legs are in proportion to your trunk, examining your eyes, listening to your heart and lungs. Order diagnosis testing to evaluate heart, lungs, and eyes that may include CT scans or MRI of the chest to check your heart, lungs, and surrounding tissue. Echocardiography to evaluate the heart structure, valves inside the heart, and blood vessels around the heart. ordered testing to rule out other conditions that may be causing your symptoms. In most cases, genetic testing is helpful in detecting the mutated gene that causes Marfan syndrome. When I went to the geneticist, because I wanted to, let me start at the beginning. When I was born, because of my weak joints, they misdiagnosed me as Ehlers-Danlos. But they did not do the genetic testing because my parents focused more on my scoliosis once that got diagnosed. So I went 30 years with just the overall diagnosis of Ehlers-Danlos syndrome. Didn't know what type, didn't know much about it. So once I became an adult, I started doing research. And 30 years old, I decided, hey, I want to find out more. I'm going to do a genetics test. So Mom agreed to drive me to New Orleans to go do this. So I went 30 years thinking I had one diagnosis, which was Ehlers-Danlos syndrome. Turns out it was Marfans Syndrome. And the doctor said that it happens a lot, that doctors misdiagnose. But yeah, the doctor did all those things. So apparently I'm a Marfan Syndrome kid. Well, I'm not a kid anymore, but y'all know what I mean. Anyway, peace. And now for how to treat the Marfan Syndrome. There is no cure for Marfan Syndrome. Instead, doctors focus treatment to relieve symptoms and prevent additional problems or complications. Treatment depends on the area of the body affected by the syndrome and may include medication, other treatments, and surgery. Doctors may prescribe the following medication: beta blockers or angiotensin receptor blockers to help manage problems with your heart. These medications can help your heart beat with less force and more slowly. Anti-inflammatory and pain medication. Other treatments may include braces to help keep curves in the spine from getting worse. Yeah, that did not work. Which, I had braces for my back when I was a kid. God, I hated getting molded for those things. Anyway, according to my doctor, the braces did not work. Yeah, I wore them from age 2 until age 8, and after that, the doctors were like, okay, it's not helping her back's getting worse. Let's stop torturing her and keeping her in this tight brace that's hurting her stomach when she eats, making her sweaty in the summer. Yeah, the braces are miserable, but that's another story. Glasses or contacts to help correct vision. So as you can see, I wear glasses, and each year the prescription changes. Lifestyle changes that include lowering emotional stress. Yeah, that's kind of hard in this world. Pretty much everything pisses me off. When possible, that may raise your blood pressure or heart rate. Yeah, don't get me pissed off, because I will literally start crying and shaking. I get that emotional. Avoid high exertion or contact sports or physical activities. Encouraging mild to moderate physical activities such as swimming. Oh God, I love swimming. I wish I had a pool. Or access to one that's free. Walking, bicycling, which allows you to set your own pace. Yeah, I can't ride a bike. My balance sucks. I would have to get one of those handicap bikes that have 3 wheels. It's kind of like a trike, but it's for adults. Talk to your doctor before beginning any exercise program. Physical or occupational therapy to help strengthen your muscles and manage orthopedic problems and complications. I used to be in physical therapy, but I'd rather live my own life and do the therapy treatments they told me to do at home. So, anyway, there's more. I'll talk to y'all later. I'm running out of time. Bye. And we are back to discuss more treatments for Marfan Syndrome. Some people with Marfan Syndrome may need surgery to correct the problems or complications that can happen. Surgeries include orthopedic surgery to correct more serious problems with skeletal and sternum. Yes, I had multiple surgeries on my back for scoliosis, which they don't know if that Marfans caused the scoliosis or if I was going to have scoliosis anyway. That's still up in the air. I love being a medical puzzle. Eye surgery to treat some complications such as retinal detachment or cataracts. Cardiovascular surgery to correct problems with the heart, blood vessels, and lungs. I did not have a surgery on my heart, but I did have what's called a ablation because I had Wolff-Parkinson-White syndrome, which my geneticist says is very odd for somebody with Marfans. That's usually a Ehlers-Danlos thing, so maybe I have a mix of both. Who knows? But yeah, I have Wolff-Parkinson-White, which is an excess chamber in the pathways of my heart. So an ablation is where they go in and they burn off that access pathway. You're sedated, but you're awake. I remember being halfway awake and I had my iPod and I was listening to music, but I couldn't move. So I kept bugging the nurse anytime a song I didn't like come on. I was like, hey, can you come change my music? I think his name was Keith or Ken. Something with a K, I remember. And I kept going, hey, Ken, Keith, whatever. I can't remember his name anymore, sorry. But, come change my music. I don't like this song. If it was Ken, I should have been singing Barbie Girl to him. I'm sorry. Anyway. Yeah. Next, we will talk about who treats Marfan syndrome and how to live with Marfan syndrome. But I am low on time, so I'm not going to get into it this part. Have a good day. So, who treats Marfan syndrome? Alright, healthcare providers who may treat Marfan syndrome, cardiologists who treat issues with the heart, cardiothoracic surgeons who specialize in surgery of heart, lungs, and other organs and tissues in the chest, clinical geneticists who diagnose and treat children and adults with genetic disorders, dental providers such as orthodontists, and oral maxillofacial surgeons. I went to an orthodontist. I went to a geneticist. I have a cardiologist. Dermatologist. Yes, I go to a dermatologist because I have bad breakouts. Who specialize in conditions of skin, hair, and nails. Mental health professionals. I don't do that. I tried it. I didn't find it worked. So I journal and just try to leave it to God. Try to remain optimistic. Now, no shade to whoever goes to mental health professionals and it actually works for them. Nurse educators who help you understand your condition, help start treatment plans. Occupational therapists who teach you how to safely perform activities of daily living. Yeah, I need an occupational therapist on how not to be a klutz. Because, gosh, I dislocate shit all the time. Ophthalmologists to treat eye disorders. Orthopedists who treat bone problems. Pediatricians who diagnose and treat children. Physical therapists who teach ways to build muscle strength. I used to go to a physical therapist, but she ended up with her own health problems and had to close her clinic. And I could go to the hospital one, but I don't want to. Primary care doctors and pulmonologists. I go to a lot of these. I have a pulmonologist on retainer. I go to a primary care doctor. I used to go to a physical therapist. I do my physical therapy at home now. I used to go to a pediatrician. I don't go to a pediatrician anymore. I'm 31. Orthopedists. I do go to a pain management doctor who's an orthopedist. I go to an ophthalmologist who does eyes. Dermatologist, dental care, geneticist, and cardiologist. So that's everybody that can treat people with Marfans. Next part will be living with Marfans, which ought to be interesting. Anyway, Peace out for now. Drumroll! Learning to live with Marfans Syndrome. This is going to be the most interesting I feel. I haven't read any of this research yet. I want to do a video while reading it. And this will be the last part of Marfan's info. Anyway, treating and living with Marfan Syndrome and its complications is a lifelong process. However, advances in treatment make it possible for people with this disorder to have long, productive lives. Hear that, ableists? We don't stay at home cooped up all the time. Woo! What a shock! Sorry. The following tips can help you manage this disorder. Ask your doctors how often you should schedule follow-up visits. Regular visits are important in managing Marfan Syndrome and preventing complications. But yet, you also don't want to live in hospitals. You gotta do you and just figure it out. The visits may include regular eye exams, image tests to check your heart and lung problems, and an evaluation of your skeletal and growth. Reach out for support. Talk to your family and friends about the disorder and your feelings. Or be like me and journal everything and keep it bottled up. No, that's not healthy. Don't keep it bottled up. That was a joke. Not something to joke about. My bad. But yeah, journal, talk to somebody you trust. It's just, I have a hard time unless I write it. I'm better at writing than expressing my feelings verbally. Consider joining a community or online support group. I am on many Facebook support groups. Seek counseling or talk to a mental health care professional if you feel depressed or anxious about the Marfan Syndrome and its effects on your body. I don't do that. I just wait until I start spiraling and crying and drown my sorrows in ice cream. But that's not healthy. Eat a healthy, well-balanced diet rich in fruits, vegetables, and whole grains. Yeah, that's a little hard when you have a crazy stomach and you don't know what triggers your crazy stomach. And plus I have acid reflux, so I really can't eat a lot of fruit because citric acid. And I used to love tomatoes, and I can't eat that no more. Consider wearing medical identification to notify providers about your condition during an emergency. There is a lanyard you can get. I forget what it's called, but I don't do that because usually I'm always with somebody. Anyway, that's enough Marfans info. God bless.